Today we are discussing HIV Testing Day. I'm just waiting for Whitman-Walker to get here and we'll go ahead and begin. Where area does your nephew live in? He can get tested anywhere without an ID. There's lots of places, and especially during the summer, he can go to any type of event or anything. In Southeast, oh yeah, he can go to Whitman-Walker, to Max Robinson. There's a Max Robinson has, Whitman-Walker has a location in the Southeast where he can go to any other nonprofit in the area as well. But of course, everybody knows my name is Corey, and I use he, him, his pronouns. In the past few months, Whitman-Walker Community Health Department has expanded its outreach efforts to social media platforms. We cover various topics about HIV and STI sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to support and educate everyone. A little bit about National HIV Testing Day was first observed on June 27th of 1995. This day is to encourage people to get tested for HIV and know their status and get linked to care and treatment if they need to. Being positive, you definitely need to be linked to treatment and care. The theme for 2022's day was HIV testing is self-care. All right, Whitman-Walker's here. So the theme for 2022 is HIV testing is self-care. Giving that self-care has been a particularly important topic during the COVID-19 pandemic. It is also timely as it needed for individual and community actions to promote physical and mental self-care to remain critical. HIV testing is an act of self-care, according to the CDC. Encouraging people to get tested and know their status can help people stay healthy. Today, there are more free, easy, fast, and confidential HIV testing available than ever before, including self-testing, the first step to engaging HIV prevention or treatment services. HIV testing is a critical tool to helping us end the HIV epidemic in the United States of America. There's different types of tests. HIV tests are very accurate, but no test can detect the virus immediately after infection. HIV, how soon can a test detect HIV depends on the type of test that's being used. There are three types of HIV tests: an antibody test, an antigen, an antibody test, and a nucleic acid test, or NAT. An antibody test looks for antibodies in the HIV to, antibodies to HIV in a person's blood or oral fluid. Antibody tests can take 23 to 90 days to detect HIV after exposure. So 23 to 90 days at the antibody test. So 23 to 90 days, that's when the antibody test is able to detect the HIV. It detect the antibodies of HIV after exposure. The most rapid is one of the most rapid tests in the FDA approved HIV self test after after the antibody test. In general, antibody tests that use blood from a vein or can detect HIV sooner after an infection. The tests are done um, with blood with blood from a finger stick or with oral fluid. An antigen and antibody test. Tests look for both HIV and antibodies and antigens. Antibodies are produced by the person's immune system when they're exposed to the virus like HIV. Antigens are foreign substances that cause a person's immune system to activate. If a person has HIV, an antigen called P24 is produced before antibodies develop. Antibody tests are recommended by testing in labs and are common in the United States. An antigen slash antibody test performed um, by a lab on blood from a vein can usually detect HIV 18 to 45 days after exposure. There's also a rapid antigen slash antibody test available that's done with a finger stick that I was talking about earlier, and that's it can detect the antigens and antibodies with between 18 and 90 days after exposure. And the NATs look for actual virus in the blood. This test should be considered for people who have had recent exposure or possible exposure with early symptoms of HIV and have tested negative with an antibody or antigen antibody test. An NAT can usually detect HIV 10 to 33 days after exposure. Like I was saying earlier, there's a lot of places in Washington D.C. that you can get tested. Not only Whitman-Walker, you can get tested at Hips. That's right off of H Street. Us Helping Us is off of Georgia Avenue. If you're close to Carrollton Station, Denham, that is also in the Us Helping Us cohort. There's a lot of different places to get tested. You can also just Google, um, and you can also just Google and ask like different like just look up HIV testing, and they'll give you a whole list. But Whitman Walker does have testing services, of course, including the rapid HIV test, a rapid HIV test. They have risk reduction counseling. There's also an entire prep team. You can schedule an appointment at 202-797-4439. You can also schedule an appointment if you would like pre-exposure prophylaxis. It is actually a pill that prevents up to 99% of contracting HIV. You can call the PrEP phone line at 202-939-7690 or email prepclinic@whitman-walker.org. But before we go, if you already get, I have to give you some reminders about COVID-19 and the vaccines. If you've already gotten the vaccine, then congratulations. You've taken a really important step to preventing yourself, loved ones, and your communities from illness. Variants are soaring across the United States at the moment. It is totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. More contagious variants are spreading. Make sure that you keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman Walker, of course, has COVID-19 vaccine available for everyone 5 and up are eligible for a COVID-19 vaccine. Please reach out at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us for DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. You can track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait. For Maryland residents, you can learn more about the Maryland vaccination distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccination portal here. If you live in Montgomery County, you can also visit their vaccination portal here or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you get the vaccine, discuss COVID precautionary measures, and with those around you, and be mindful of mask wearing and keeping your distance, especially when you're not aware if a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website at Whitman-Walker for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. You can follow some more of our programs and other Whitman-Walker family at Real Talk DC _ or at No Filter.